Good day. Your third quarter health topics are very timely and very relevant what is happening right now, the pandemic of COVID-19. Our topic is about stages of infection. Disease is any disorder where the body's normal structure or functions are disrupted or impaired. It could be fever, colds, allergy in skins, etc., and some causes death like HIV/AIDS and COVID-19. Infection: the invasion of germs and their growth in the body. Infections can begin in the body anywhere and can spread across it. Preventing and managing diseases is a very serious health issue because it affects the quality of the lives of people. Incubation stage: the period starting from the entry of the pathogen until the appearance of the first stage. Usually no sign of symptoms or person having incubation stage are asymptomatic. Prodromal stage starts from the onset of non-specific signs and symptoms such as fever. This symptoms shows because your body is trying to fight the agents of infections like germs, virus, bacteria, etc. Illness stage begins when more specific signs and symptoms appear. Your body right now is doing all it can do to fight the disease. Convalescent stage: interval when acute symptoms of infection disappear. This is good on the person who had disease, but this is very dangerous to the person surrounding the patient because this stage is said to be more infectious. Communicable disease are the diseases that are transmissible from one host, person, animal, or other objects, to another. Communicable disease is caused by the organisms called pathogens. Pathogen is an organism that causes diseases, e.g., viruses, bacteria, fungi, protozoans, parasitic worm and rickettsia. Communicable disease can be transferred from one person to another. The goal of this pathogens is to multiply and infect many people. How the disease is being spread. This is with the mode of transmission. We have the direct transmission. There is a physical contact happened between the pathogen and the host. The first direct transmission is contact transmission. These are kissing, handshakes with a sick person and sleeping with someone with lice. The second direct transmission is food-borne, water-borne transmission. The infection gets in the contaminated food or water. X. Viral hepatitis, cholera, bacillary dysentery, hepatitis A and E. The third direct transmission is vector-borne transmission. The infection is carried by the insect or animal. Example are mosquito bites, dengue fever and malaria, and dog bite, rabies. Another mode of transmission is the indirect transmission. There is no physical contact happened between the pathogen and the host. We like the droplet transmission. Example are coughing, influenza and common cold and sneezing, pneumonia infection. Another one is airborne transmission. Examples are pulmonary, tuberculosis, measles and chickenpox. Now let us go the examples of communicable diseases. We have a very dangerous pneumonia. An infection that inflames lungs, air sacs, alveoli. Symptoms are cough, fever, chills and trouble breathing. The mode of transmission is through droplet transmission. Now we have influenza. A respiratory illness caused by influenza viruses that infect the nose, throat, and sometimes the lungs. It can cause mild to severe illness, and the severe case can lead to death. The mode of transmission is through droplet transmission. Dengue. a disease caused by the pathogen called dengue virus from a bite of female mosquito. Symptoms are fever with nausea, vomiting, rash, aches and pains. The mode of transmission is through vector-borne. Tuberculosis, an infection caused by a bacterium called Mycobacterium tuberculosis. The bacteria usually attack the lungs, but tuberculosis bacteria can attack any part of the body such as the kidney, spine, and brain. Symptoms of this disease are chills, cough, fever, weight loss and night chills. The mode of transmission is through airborne. Now let's talk about sexually transmitted disease, STD, disease that is spread by pathogen from one person to another through sexual contact. Symptoms may vary depending on the type of STI, but in common cases it is usually rashes on the genital area, sore throat and fever. The mode of transmission is through contact transmission.
HIV and AIDS. AIDS, also known as acquired immunodeficiency syndrome, is a fatal disease caused by HIV, which means human immunodeficiency virus. It attacks the immune system of the body and cannot be cured with no effective treatment as of the moment. Symptoms are rash, sore throat, fever, and tiredness. The mode of transmission is through contact transmission, like sex and blood transfusion.
Remember that every individual should maintain a healthy body to enjoy living in an ever-changing environment. To attain a high level of health and fitness, one should be free from illness and diseases. Let us begin. A disease is a disorder of structure or function in a human, animals, or plants, especially one that produces specific signs or symptoms or that affects a specific location. The pathogen are a bacterium, virus, or other microorganisms that can cause disease. The immunity is the ability of an organism to resist a particular infection or toxin by the action of specific antibodies or sensitized white blood cells. A susceptible host is the final link in the chain of infection as a susceptible host, someone at risk of infection. The mode of transmission is the route or method of transfer by which the infectious microorganism moves or is carried from one place to another to reach the new host. The reservoir is the specific environment in which an infectious pathogen naturally lives and reproduces, or upon which the pathogen primarily depends for its survival. Bacteria is a one-celled organism that ranks among the widespread of living things. A type of bacteria known as toxin bacteria lives in soil and can cause botulism, food poison. Another type is resident bacteria lives in human mouth, intestines and skin. Examples are lactobacilli and coliform bacilli. Rickettsia is an organisms that are considered intermediate and usually lives in small insects like ticks and lice. Typhus fever and Rocky Mountain spotted fever. Now we have the famous and deadly virus. Small simple life-like forms from 1/2 to 100 the size of bacteria. Example is rabies virus, attacks brain cells. The fungi is a simple organisms that cannot make their own food like yeast and mushroom. Commonly present in this area scalp and athlete's foot. The protozoans are single-celled organisms that are larger than bacteria and have complex cellular structure. They causes malaria, African sleeping sickness and amoebic dysentery. The parasitic worm, a parasite that usually lives, grows and multiply on human intestines. It is also called helminths. Roundworm lives in intestines that causes anemia and malnutrition. This pinworm lives in intestines. This causes anal itching, pale skin and stomach discomfort. The Trichina spiralis, they lives in intestines. It causes vomiting, diarrhea and abdominal pain. The tapeworm lives in intestines and it is being transferred by its egg from one host to another. It causes abdominal pain, fatigue, weight loss and diarrhea. The fluke lives in intestines, bladder, rectum, liver, spleen, lungs and veins. Rash, itching, muscle aches, coughing, chills and fever. Remember that health is both personal and social responsibility. We need to protect ourselves from these diseases to protect others, especially our loved ones. Thus, disease prevention and control are important concern because it can affect the quality of people's lives. That's all for today. Thank you and God bless.